Welcome to Soul Wellness with Kristen, where we get into the nitty-gritty of various holistic modalities and explore exactly how they help you heal. I'm your host, Kristen, and I invite you to join me on this enlightening expedition where we explore the connection between mind, body, and spirit. In each episode, we'll talk in depth with holistic providers, medical professionals, therapists, and healers. Our goal is to empower you with knowledge, inspire you with stories of resilience, and provide practical tools that you can integrate into your daily life. So, find a comfortable space and join us as we explore the multifaceted world of holistic wellness. Get ready to learn how to improve every aspect of your life and simply feel good. The adventure begins now. Thanks for joining us. Today I have Dr. Erin Wilbanks with me, and she is with Holistic Dental Centers in Cornelius. So welcome, Dr. Wilbanks.
Hi, I'm so happy to be here. Thanks for having me.
I am loving this because this is kind of part 2 of the Holistic Dentistry podcast. I can't help it. I geek out on this stuff.
I know.
And I just had to have you come on, and we're going to talk about some different things. So how long have you been with this dental center?
So I've been working with Dr. Carl for about 2 years now. So coming up on 2 years. I moved to Charlotte about 4 years ago from Louisiana. And so I was born and raised in Louisiana. And that's where I did my undergrad. I went to LSU and then dental school at LSU as well.
Very nice.
So once I graduated, I said, goodbye. I'm headed to Charlotte.
Did you always know you wanted to go into holistic dentistry?
So that was a discovery while I was in school. And I feel very lucky and blessed that I did come to that realization when I was in school. I was kind of on my own health and wellness journey, kind of geeking out with health and wellness podcast and started looking a lot of I need to, start focusing on eating more whole foods and getting organic food, and started looking at my personal care products and trying to just eliminate toxins. And in the same time was in dental school where it was super traditional, and so it was very much like we were still placing mercury fillings and there was a requirement for that, and, water fluoridation, all these things. And it felt like it didn't fit with my lifestyle at the time. And so I remember feeling a little disheartened for a while because I was like, how am I going to feel good about going to work and be able to treat patients the way that I would want, to be treated. So then I just literally got online and was like, holistic dentistry. I just Googled it. And I was like, is this a thing? I don't even know. So I found the IAOMT, which is the organization that made the stake removal protocol for amalgams, and they do an accreditation and everything for biologic dentistry. So I joined as a student. Didn't know what it was going to turn into. I was like, oh, sure, let me just join, And they had a student scholarship at the time to go to one of their conferences. And so got to go to Vermont for free and learn a ton. And I remember I brought my friend alongside me, and she's a holistic dentist too in Florida. And we both, I remember after that long day of lectures, it was lectures all day. We got back to our hotel room and we looked at each other and we were like, this is it. We just couldn't even believe it. It's like one of those things when you open your eyes to it or when you learn about it, there's no way that you're going back. So
you just can't.
No, you couldn't. So I just went back to school, and it was hard because you kind of had to keep your head down and just kind of go, with the
traditional.
So, but yeah, I mean, I knew immediately. I was like, I can't practice traditionally, and I'm so glad. I feel like I saved myself a lot of occupational hazards with mercury and everything.
Oh my gosh, yes. I have learned so much from you and Dr. McMillan from doing these podcasts, and now I come to see both of you, and I'm floored. I had no idea.
I know. Most people don't, and it's really exciting because I feel like now the word is getting out more, and people are learning more, and people are wanting to take their health into their own hands and are getting just kind of fed up with the traditional medical and dental model. And a lot of it is just, honestly, a big part of it is on just insurance companies and how they're making a lot of these offices run. And they're like, I see my dentist for 2 seconds. They, don't have time. We're not able, a lot of dentists aren't able to spend a lot of time on prevention and education and really what it should be. We should be able to sit with our patients and figure out if they are on this kind of disease cycle or whatever it is that they're going through. really taking the time to uncover all of those things and get to the root cause, because just so many people are on just this disease cycle.
Right.
They're just like drill, fill, bill.
Yep.
These problems never go away. They're just managing the symptoms. So my passion is to really get to the root cause of people's issues to get them out of that cycle.
And we were talking before we hit record about the fact that you see a lot of kids.
Yes.
And we were talking about how important it is for parents to really think about, before you have teeth pulled, before you have braces, before even the child turns, 6 or 7, it's like you really need to be looking at what's going on early in life. So talk to us a little bit about that.
Yeah, it is so amazing what we can do when we focus on prevention. And I see all ages, and I see so many adults that are like, oh my goodness, if we could only turn
had
the
only
clock
known
backwards. There are so many things that we could have prevented. And it goes more than just teeth and gums. It's about the whole head and neck. And it's about the whole environment and how we're functioning and our skeletal structure and how we're breathing. And it's so important that if we could take that child and kind of figure out if there are any imbalances or dysfunction, anything that we're seeing awry with the tongue and the soft tissue or the skeleton or their breathing, anything in that aspect, we can kind of course correct really early and then set that child up for success for the rest of their life.
And when you say early, you're talking under what age?
Well, ideally, we really like to see kids by the age of 1 or by the time they have their first tooth. That's typically the best time for a checkup. And you don't really do much then, but it's a lot of education and taking a look to see, if there's anything really awry. But there are a lot of things, a lot of behavioral patterns and oral function patterns that we establish as early as infancy that stick with us for the rest of our lives.
Talk to us about that, because if any moms are listening to this, they're going to, maybe some light bulbs will go on.
Yeah, and it's tough too, because a lot of these things aren't really being identified or diagnosed by a lot of practitioners, and then there's a lot of confusion too. And I will say that this kind of topic, especially airway and tongue ties, all those things, it is a rapidly evolving topic. We're getting more and more information by the day. And literally just 5 years ago, we didn't know a lot of the stuff that we know now. So it's becoming more mainstream, and also we're learning more as we go. So it's rapidly evolving. But basically, you have an infant, and we see, for one reason or the other, a lot of infants that have a tongue restriction or a tongue tie. And even if there's not necessarily a large tongue restriction, we can still learn to use our tongue in an improper way.
How does that present itself, though? How would you know if your infant has a tongue tie?
So it's best to work with a good lactation consultant for them to evaluate. And basically, it's this pattern that we call the suck and swallow pattern. So breastfeeding, you're definitely setting your child up for better dental development, better success and functional success too, by breastfeeding. Basically, the suck-swallow pattern that we develop when we're fed with a bottle, it's improper. So it's just not how we're supposed to develop that suck and swallow pattern. And then we also have a lot of habitual patterns too that can affect it, which pacifiers, thumb sucking, things like that. All of that is going to affect the function and how we're developing. So really trying to find a good lactation consultant to look at those functional patterns. Craniosacral therapy can be really beneficial. Chiropractic care, just to make sure that there aren't any interferences and that we're functioning properly. Sometimes a tongue tie release is needed for that infant. So that does happen. Now, those stretches after a tongue tie release are really, really important. And a lot of times people think that, oh, well, my child breastfed okay, or they had a tongue tie release and they breastfed fine after that. So they think that there might not be any issues in the future, but that is not the case.
Okay.
We can still see different signs and symptoms as that child gets older. So I would say there's really two things that we're looking at a lot. One is going to be the skeletal development. So But the skeletal development is really set forth by our function. So when I mean function, it's how we're using our tongue, how we're using our other facial muscles, how we're breathing. I think a lot of people have seen, there's very famous pictures of like a diagram of the face of a mouth breather versus the face of a nasal breather.
Okay.
So mouth breathing, especially as we're young and as we're developing, mouth breathers are typically going to have more narrow jaws, so smaller jaws. They're going to have tooth crowding, dental crowding. They're going to have longer faces and more asymmetrical faces. And then a lot of times too, they'll have kind of dark circles under their eyes, crooked nose. Mm-hmm. So all of these are actual skeletal changes that we see just from improper breathing.
Wow.
And function. Yeah, it's fascinating. So what we really want to see, it's all about the tongue. It all starts with the tongue. So our tongue is our natural palate expander. So it's so important as a kid and adult too, even after we're done developing, to have proper tongue posture. So I always ask people if they know where their tongue is supposed to rest. And most people are sitting there trying to figure it out like, where does my tongue go?
Okay, so tell us, where's your tongue supposed to be?
Yeah, so the tip of the tongue should be behind the upper front teeth on the palate. And a lot of people can do that well, but another really important thing is that the whole back part of the tongue, the whole posterior part of the tongue, should also be contacting the palate. So your tongue should be suctioned up to the palate at all times.
Oh boy.
It's not easy for a lot of people.
I don't think we have contact.
It's not easy.
Wow.
So it can be, due to a tongue tie because like of an actual physical restriction that the tongue can't go there. Mm-hmm. But even just from a tongue strength standpoint, sometimes it can be just like not having enough tongue tone. So you really have to do some training, which we can get into, but the tongue posture is number one, and especially at a young age because our tongue is our natural palate expander.
Wow.
So that jawbone, that upper jawbone, is not going to have the signal to develop widthwise if that tongue is not pushing up on the palate to stimulate that.
Makes sense.
So it all starts with the tongue. And so also with the breathing aspect, when your tongue is suctioned up on your palate like that, you can't mouth breathe. So you have to nasal breathe. So mouth breathers are going to have that low tongue posture. Okay. And so all of that changes that skeletal development. And so it's affecting our immune system. It's affecting our sleep. It's affecting our health.
You're not getting as much real rest.
No, you're
when you
not.
think you're asleep, you're not really going probably into the really deep sleep.
Exactly. You're not. And you're not producing nitric oxide, which we only make nitric oxide when we breathe through our nose. And that's our body's anti-inflammatory molecule. And it's really important to produce. And it affects our body's pH. And it's really important for your cardiovascular system. Another thing I see too is a lot of people will go, oh, I don't mouth breathe. I don't mouth breathe. And they may not during the day. They may not. But I find that a lot of people do mouth breathe, especially when they sleep, and have no idea.
Right.
So it is definitely something that's really common. Even I have good tongue posture. I train myself. I'm always thinking about it. But even when I fall asleep, my mouth falls open and my tongue rests low. So it's something that's difficult and takes a lot of training. And so trying to get that training down from a young age is important.
Wow.
Yeah.
Yeah.
It's fascinating.
It is just incredibly fascinating. You were talking about how the fascia runs from the tongue to your toes, basically.
Yes. If there is a tongue restriction and that tongue is constantly being pulled, it's really tight, it's going to cause that deep fascial tension, which that fascia is that connective tissue. It connects everywhere in our body. So that tongue fascia connects all the way down the tip of our toes. So you'll have a lot of more forward head posture, people with tongue ties. Also, people just with small airways have more forward neck posture, and that's literally to open the body, trying to open up the airways so you can breathe. So especially my people they're like, oh my gosh, yes, I have chronic tension in my neck, my upper shoulder.
That would be me. Yes.
And or like I go to the chiropractor and they're always like it's the same spot in my cervical spine every time I go in. A lot of this is just because your fascia and your tongue and the way you're using your tongue and everything is just functioning improperly. So it's just pulling that spine back out of alignment. It's pulling you forward. So a lot of like TMJ issues too, that tongue is related to. Tongue posture for people with TMJ issues, tongue posture is number one. Working on that tongue posture will alleviate so many of those TMJ issues.
Wow.
I know.
I wish I would have known this 20 years ago.
I know.
Because I am a chronic headache sufferer, tense neck, always have a neck ache, pain in my neck. And I can remember going to a chiropractor for years, and he would have a hard time even adjusting my neck because it was so tense. No idea that it was coming from a tongue tie and all of this other fun stuff that I'm learning from you guys.
Yeah.
Wow.
It's crazy too how everything kind of presents with different signs and symptoms as we age. So signs of what we call orofacial dysfunction, meaning like just, dysfunction of our tongue and all of our other facial muscles, that looks different in a child than it looks in an adult. And another frustrating saying that a lot of traditional dentists would say was especially like kids grinding their teeth, right? Oh my gosh, my child's grinding their teeth, all their teeth are ground down, and dentists used to be like, oh, they'll grow out of it. They'll grow out of it. They're just growing. And I still see dentists saying that on these message boards that I'm in for dentists. And I get so frustrated because it's not true. Teeth grinding in kids is not normal. Mouth breathing in kids is not normal. It's common, but it's not normal. ADHD is not normal. All of this is related to oxygen and breathing and how we're functioning. Kids who are not breathing properly, again, they typically have ADHD, ADD. In my opinion, before any kid gets medicated, they should be evaluated by an airway aware dentist.
100%, yeah.
Because if we can get this kid breathing better, a lot of their ADD, ADHD issues are going to go away. Bedwetting, swollen tonsils, adenoids. These kids are having to get their tonsils, adenoids taken out. That's related to mouth breathing. Dark circles underneath the eyes, you see that a lot. That's related to mouth breathing. Also, you think about an adult, like, oh, someone with classic sleep apnea. You think, oh, that adult's going to be heavier weight. I will say the days of that mindset are gone. Right. Because it's not true. And also for kids, typically when they're sleeping, if they're sleeping really well and going into the deep stages of sleep, that's when they're producing their growth hormone. So if a kid is not sleeping well, they're not going to be producing that growth hormone. So they're actually going to be thinner and lankier than the average kid. I'm trying to think what else we talked about. I think I mentioned bedwetting. Also just like restless sleep, tossing and turning, waking up in the middle of the night, sleepwalking, a lot of different things there. But it is really, really, really common. It's rare for me to see a kid come in without some type of sleep and breathing issue. And it's honestly, it's an epidemic. Yeah. And there are a lot of different reasons why we are like this now, but it's crazy because if you go back and look at ancient skulls, they were all nasal breathers. They had the widest jaws. They had room for all of their teeth. They didn't have their wisdom teeth have to come out. They didn't have all this crowding, orthodontics and tooth crowding. It's a modern problem. It's because our jaws are not developing.
And I feel like even when I was a kid, the dentist wanted to take my wisdom teeth so bad. Yeah. And I just kept standing my ground. I knew both my parents had their wisdom teeth. Why can't I keep my wisdom teeth? Right. And I remember every time I would go in to get my teeth cleaned, he would say, we need to talk about going ahead and getting your wisdom teeth out. I'm like, nope, I don't think so. Yeah. And it's just interesting. I think there's like a pulling tooth happiness or something. Yeah. What is this?
Yeah, and it's just because, honestly, I feel like for a long time, we didn't really know why. And again, like a lot of this is newer information. Yeah. But the thing is, when we were talking about the earlier, the better, the easier to treat. So if you have, a 20-year-old and they're pretty much done growing and they don't have room for their wisdom teeth, they probably need to come out. But if you can address that kid when they're 4 or 5 and start, we're seeing they have low tongue posture or a tongue tie. Okay, we're going to work on that. We're going to work on nasal breathing. We're going to work on all these different things. Then we can potentially get that jaw to develop enough to support those wisdom teeth and avoid having all the dental crowding and issues. But that's really why it's so important from just a young age. Prevention, intervene, and there are some easy thing. I mean, it still does take a little bit of work. Like, you've got to, want to address the issue, and it does take some work, but I try to stress the importance to parents and to people, young people, because I just see so many adults that just have so many chronic issues that they've been battling for so long, and they're in pain, and they're like, I'm having all this recession, I'm having all this sensitivity, I can't sleep well, just all these problems. And, we can address it as an adult, but it's just so much easier to get to that root cause when you're younger.
When you're little, I'm in that boat right now. I'm just thankful that I found you guys, and I'm learning from you, and it's a interesting journey to try and undo some of this at this age. It's hard. It's hard work no matter what. But kids who are mouth breathers become adults with sleep apnea. Wow. So I would just implore any parent that's listening, like, if you recognize any of those symptoms that I mentioned, even if you have just like an inkling of like, maybe, I just encourage you to bring your child in to a dentist that has airway education. Yeah, absolutely. Because doesn't it make you kind of cringe now when you hear these 11 and 12 and 13-year-olds, the dentist wants to take some teeth out, we're going to put you in braces, they probably have not addressed the palate, the tongue, nothing like that.
I was almost in tears the other day of this girl that came in with her mom, and she was, I think, like 16. She had just finished 3 years of braces and had jaw surgery. She had jaw surgery and 3 years of braces. They took 2 teeth out. I'm looking at her before I've even looked in her mouth. She can't close her lips all the way, which is really important. We want to make sure we can get a good lip seal. So she can't physically close her lips all the way. She's breathing through her mouth. She can't nasal breathe. So this poor little girl went through jaw surgery, and she still is a mess. I took a look in her mouth, and it's not her fault. I'm like, oh my gosh, it's just such a shame that, because those are, she had surgery. She had teeth taken out. She had braces for 3 years, and she's in a horrible position now. So I'm just picturing this 16-year-old girl, they just went to this orthodontist and trusted the orthodontist, and now she has all these issues. So that's another thing. If your child, or you are recommended to have permanent teeth taken out for orthodontics, highly, highly, highly encourage a second, a third opinion. Before you jump into anything serious and irreversible like that, get all of the opinions.
I agree. I mean, it's just not that big of a deal to make an appointment. Exactly. To have a consultation, to listen to somebody that's in the holistic field say, no, there's another way to address this. Yeah. Because you're going to spend thousands of dollars on braces and possibly jaw surgery. Yeah. And if it's not the right thing to do. Yeah. A lot of money, a lot of time, a lot of discomfort to put yourself in a situation where...
To have to undo. Exactly. Yeah. Yeah, it's a shame. So just, I would say too, like we were talking about someone earlier, where it's like, go with your gut. Like, if you have this weird gut feeling, like something... I feel like I just kind of want to get another opinion, like, just do it. Yeah. Just trust yourself, trust your gut instinct.
Absolutely. If you hear something that doesn't feel right, and I tell people that all the time, if you go to your doctor and they want to put you on something that doesn't feel right, don't just take the prescription and run.
100%.
Go question it. Look, do some research, talk to some other people. Yeah. Your gut is your biggest indicator of
so true.
Which way you need to go. Yeah, for sure. So we've talked about a lot of different oral dysfunctions that parents can look for. What are some of the treatments for that early on?
Yeah, so it's typically a multitude of things, but one of the most important things, and for adults too, is something called myofunctional therapy. So what it is, how I explain it, It's essentially physical therapy for the oral facial muscles.
Okay.
So most myofunctional therapists are either speech language pathologist or hygienist, dental hygienist. So there's a few really good local ones in the area. But they essentially work with the patient to establish 4 main principles. And so that's nasal breathing, lip seal, so having those lips completely closed, proper tongue posture, which we talked about, and then proper swallowing as well. So it seems so simple.
It does.
But most of us have dysfunction in some of those other categories, or some of those categories. And what that looks like is when one of those things is off, it affects everything else too. So you'll see a lot of people when we're trying to do certain exercises, or I'm like, okay, move your tongue this way or open this way. And one of the big ones is I'll have people open and I'm trying to look at their tongue function and their tongue mobility. And I'll be like, okay, bring your tongue here. And their neck, they're tightening their neck up, and you see these tight lines in the neck, or they're grimacing in their face. Like you can
strain.
See it. Yes. Mm-hmm. Everything is just so tense, and you're using all of these other different muscles to accommodate and compensate for that lack of range of motion in the tongue or the lack of strength in the tongue. So that therapist, it is simple, but also very in depth and very important. Myofunctional therapy is one of the most important things that anyone can do. And in a kid, also in an adult. And then especially if someone says you have a tongue tie and you might need to have your tongue tie released, you should never, ever, ever, ever have a tongue tie release except for an infant without myofunctional therapy before and after. You will potentially get a lot worse. Mm-hmm. And you're really having a surgery. A tongue tie release really is a surgery. You're having a surgery without really doing the proper prep work around it.
And the tongue can then fall back.
Exactly.
Right? And then that could cause you to choke? Block your airway? Yeah.
Exactly. And I've seen it. There's one patient who I know that she didn't know, but she had a tongue tie release done, and that happened to her. And she started to have so many problems. And another important thing is tongue space. So especially in an adult, for a kid, it's easy. You can start while they're still growing. You can start doing some palate development or palate expansion. But for an adult, if your jaws are way too small to support your tongue and you don't have a lot of tongue space, and then we do another important screening tool is a CBCT, which is a 3D x-ray, where we can actually measure your airway and see how big it is, how much volume, if there's a restriction, where it is. But if we look at your CBCT and we can see where your tongue is, and that if your tongue is taking up all the space in your jaws already, and then your airway is tiny, if we release that tongue,
oh my gosh,
that tongue's not going to have anywhere to go except for backwards. Mm-hmm. So then we could literally cause an obstruction and make it worse. So that's why it's so important to work with a therapist, and they will really guide and be your biggest advocate and help you prepare for a release if that's needed. But therapy for everyone is just one of the most beneficial things that you can do for your oral health. Even with patients, people who already have sleep apnea, mm-hmm. There's an amazing statistic that I love. They did a big meta review of all the literature on myofunctional therapy. People with sleep apnea, they have something called an AHI, which is basically apnea-hypopnea index, how many times basically you stop breathing. Mm-hmm. Just therapy alone, nothing else, for a kid, if they have sleep apnea, just doing therapy will reduce their AHI by 62%.
Wow.
And an adult 50%.
Wow.
So if someone even who's on a CPAP and they have sleep apnea and, they maybe can't do all these different other things, just doing therapy alone can improve their quality of sleep and their breathing so much. Not even to mention, the TMJ issues. Don't get Botox in your TMJ.
Oh,
if you have pain there, don't do that. That's just going to make all these problems worse. It's, most of the time it's a neuromuscular issue. And so just working on resetting that function is just really the foundation of everything.
Well, I'm getting ready to experience this. This will be my
I'm
first
so
appointment
excited
next
for you.
week. Yeah.
I'm really excited.
I'm excited too, because this is definitely painting the picture as to why I've had neck issues and neck strain and headaches my whole life. So yeah, I'm about to really jump in and learn all of this firsthand.
Yay, I'm so excited for you.
Too. And you're taking my metal fillings out next week.
I'm excited.
So yeah, I'm a big fan of holistic dental centers in Cornelius. So it's been awesome to have you on this podcast. Thank you so much for sharing all of this great information. I hope parents will hear this and really think about getting their kids in early for an evaluation.
Absolutely. Yeah. Again, prevention is everything. But, if you are an adult and have some of these issues, there's still so much that we can do.
I know. Look at me. Here I am.
Yeah.
Just from meeting you guys and having Dr. McMillan on the podcast first, and I was blown away. I thought, oh my gosh, I have to come see all of you guys, which I am. I'm seeing every one of you in the office.
Yeah. I know. We love having you.
It's great. This is awesome. Thank you so much for being here.
You're so welcome. I appreciate you and all that you're doing and getting the word out there about health and wellness. I love it.
This is huge. This has just opened up a whole new avenue, the holistic dentistry. Yeah. That I wish I would have known decades ago, honestly. So it's better to know it now and have a great quality of life going forward. So I'm thankful to have found you guys.
Oh, thank you.
Yeah. Well, I'm sure you'll be back.
I would love to.
I would love to have you back. Yeah, we'll talk about more. There's so many different topics we can go into.
We love to nerd out with everything.
Yes,
I love
awesome.
Nerding out.
Well, tell everybody how to find you if they do want to have a consultation with you.
Yeah, absolutely. Well, I do have a professional Instagram page if you want to give me a follow. Some little fun videos, also informational too. On Instagram, it's at Dr. just Dr. Erin Wilbanks. That's ErinWilbanks. And then our website is a little confusing, but it's smilesraleigh.com. It's because Dr. McMillan has another location in Raleigh, but the Cornelius location, you can go there too. And there's like a new patient inquiry that people can go to or just learn more about our office and what we do there. But yeah, we see all ages. We love families. People come in, they have all their kids with them and just absolutely love it. So would love to see anyone.
Wonderful. Well, thank you again.
Absolutely. Thanks for having me.
Thank you for joining us on another enriching episode of Soul Wellness with Kristen. We hope the insights shared today have resonated with you, inspiring a deeper connection to your own journey towards holistic well-being. If you enjoyed today's episode, we invite you to subscribe, share, and reach out. Your feedback fuels our mission to bring you meaningful content that educates, empowers, and uplifts. Remember, you are a vital part of this community, and together we're creating a ripple effect of positive change.